morning.
Morning. How are you?
I'm doing great. Thank you so much for taking this time to meet with us this morning.
Yes.
How is your team doing? I hope everyone is healthy and doing well.
Thank you. They are, we switched fairly, I would say, soon to do a lot of our stuff online, maintain those social distancing.
I just wanted to take this time so that our community can get to know you and understand all the hard work that you and your team are putting into this situation that we're facing as a globe. So my first question for you, what are some of the political challenges that you've faced during this pandemic? Have there been roadblocks or has there been anything unexpected in the process of navigating the situation?
I think that's a very good question. To be honest, and I guess a little bit of background since I know for a lot of people, I myself am very familiar with the healthcare system. My husband is a nurse, and I have a very complex congenital heart defect. So I have been in hospitals since I was very, very tiny and having surgeries and stuff like that. So we're very used to this healthcare system. And what's been, I think, most surprising is how public health has turned into a political issue. And a lot of the things I would say we're used to in the family of just navigating what's safe, infection prevention, things like that. And those models and behaviors now have turned into this political divide. And we're seeing something very unique right now. With the novel virus, we kind of get to see science in real life. And science is actually messy. And it's going to be ever changing, and you're going to see a lot of different things. And so we're going to hear best practices that are changing. And that can cause a lot of confusion with people. And we're having to be very adaptable to it. And so it's I guess for me, it can be very frustrating to see people not wanting to adhere to best practices that we know of due to political reasons, I would say. And I think has been one of the challenges navigating this process, just coming from the background that I have.
Definitely. Thank you for sharing that with us. I definitely feel that the negligence that we've seen is very it's horrendous and it's scary for a lot of us because it's a simple action that can be easily taken to protect so many lives from this horrible, horrible virus that we're fighting. So do you have any advice that you could share with city council members of similar towns from your experiences here in Las Cruces? Are there best practices you've been following?
Very much so. I always say we're the model of behavior as well. And so, like I said, we transitioned online, I would say, pretty early into the pandemic. And even before that, we started doing the social distancing guidelines. And then we realized, that's just not working. We have so many unique people serving on our board. And then it's not just us. If we're there, staff has to be there too. And you have to think about their health and safety as well. And so I do like that we changed to this model for right now. There are challenges, obviously, and it's perhaps not sustainable forever, but it's really something that we needed to do. So we're the models of behavior. And I would also say that any sort of counselors, mayors, anything, you need to get involved right away and stay informed. Make sure that you have a very close relationship with your emergency management team. Oftentimes it's a state function. And so you want to make sure that there's very clear communication and so that you are advocating for your city's needs with them as well.
Thank you for sharing that. Do you have any advice now for medical personnel, hospitals, doctors, or care facilities that may be considering partnering with local governments and their their process, do you have any suggestions to enhance the communication process and make sure that everything works as seamlessly as possible?
Thank you. And a big thank you to all of our healthcare individuals, from our janitorial staff that are having to do extra time, nurses, techs, doctors, our respiratory therapists are really having to work very hard these days. And so a big thank you to them. With communication, it's always very important to, I would say, clearly state your needs. And that's something I feel like I try to push, like, what do you need now? What's going on? What are, oftentimes when I see reports and look at things, I am trying to plan ahead. And I would say, I think a lot of places are doing the same thing. Hospitals are. So if you have any models showing what your needs are, that will be in the fall, because we know we're going to start having flu season come around, regular flu season. Respiratory illnesses, come around, you're going to see a jump in needs. And so let your governing bodies know those needs ahead of time. And so you have a clear plan of what you need to do. And so that everybody can kind of take in those scenarios and be able to be prepared once they happen.
Great. Thank you so much. What is it going to look like for us in Las Cruces for the next 12 to 18 months?
I'm really, really glad that you put it in those timelines, because I think a lot of times people are saying, few more months. And I think the reality is it's going to take a while for us to be able to get back to what might be normal. And honestly, I think it's going to be different because we've learned a lot of things through this pandemic as well.
Mm-hmm.
And we've been able to, in some ways, some places have been able to thrive by switching up processes, and some are suffering very greatly. But I think a lot of these types of communications through Zoom, social distancing, it's going to be very difficult, but I think it's something that's going to happen. I have 3 kids that are all school age. And I think for a lot of parents and families, we're going to see a change. We're already home with them often. I know for our family, our little one also has a medical issue. So we've been very mindful that we are a high-risk family. We're not able to go out as much. Even if guidelines are lifted and restrictions are lifted, it is just something that we're not going to be able to do. And so we're trying to figure out what can we do to help balance physical health, mental health, and I even put economic health, because it is those 3 factors I think are what everybody pretty much is worried about in some sort of fashion. And the degrees it varies will be different for each family. And so it's trying to find those balances and working at what needs to happen to keep some sort of sense of normal. And for us, I would say find little moments, if you can, to really do that self-care or family care that you need.
Yes. What are some of those practices, if I may ask, for your family?
For our family, well, one of the things that we are doing, we are going to the river, and we go on Sunday mornings, really kind of early when people aren't there, and we just float down the river together as our little group, and we're out before 11 o'clock when people are coming in, and it just kind of gives us a moment to sort of reset ourselves in a way. And then, I don't know, there's way too many electronics going on for the kids. I am having to balance that. I think that's probably a problem with a lot of people. So we're going to have to switch things up a bit, but just find those little moments.
Beautiful. Thank you for sharing. In addition to this COVID-19 crisis, we've experienced an awareness of extreme racism in America. Are you aware of any racism issues in the city's departments? What is your message on this issue?
Mm-hmm. Thank you. That's such an important question right now. And I know that we have a problem with systemic racism in our society. from how we have learned about history in school, to even, I would say, checking our internal biases and really trying to grow. And it's a hard conversation. We are women of color, and we feel and see and have experienced, I'm sure, certain issues. With that being said, I will never know the experiences of Black individuals. And so I've been trying to reach out and say, what are some of the experiences that you have faced in our community? And talk to me about that. And then let's look and work to see what we can do, if it's a policy function, if it's, you know, something that we can change. For myself, I am a new counselor, and we are learning all about the different departments and functions. And I've been very, very excited and very proud to see what our city can do. With that in mind, you know, you always want to make sure that everybody is being treated with respect and dignity, and that if there are problems from customer service or accountability issues, that we address those timely and efficiently, because we want our community members to feel safe, and we want them to be able to trust in us and know that they can come to us for help.
That's a beautifully stated response to the issue at hand. And I think I'm very proud to have a counselor on my board that has those views. You know, I am a brown woman, and my husband is a brown man, and when we have children, we will have brown children. So I really want to protect these little people that are growing up in this new world, in this new age, where equality is truly what we're witnessing at a federal level, which is beautiful. And I think that we are blessed to be in such a wonderful area where we're all treated with that equality. And there are those situations where we do need to address the problem, but as long as we have people like you and people that are ready to identify those issues and find solutions, then we're in a good place. So thank you for sharing that. What advice do you have for the members of our community in this time?
One is take care of each other and take care of yourself. I think that's been very difficult in a lot of ways. We have a family motto, is to be a good human. And that, unfortunately, I think needs to be said a little bit more often these days. I've witnessed great things from our community, great help. We were able to pass out lots of sanitation kits and masks just the other weekend. And we had volunteers that were, they were working in museums, railroad, the art museum, and they just wanted to get back out and start helping people again in any sort of way. And so I've seen how much our community can come together and work to keep each other safe and to be healthy, and they have a great love for the people here and for this town. And I want to make sure that we continue on it, because it is a very difficult time for a lot of people, and their worlds are changing, and their expectations of life, of how life should have been, are changing. And that can be very difficult for some. But I think we need to remember to act with kindness. And I'll say it again, we need to be able to make sure we're still treating people with dignity and respect. And then I always say that all my citizens count, you know, all my constituents count. I have nursing homes in my district. I have small businesses in my district. I have generational families that are living together. And so when I make those decisions on the council, I have to think of all those different aspects and to make sure that we are doing right by them all. But also for me, my bottom line is their health and safety. And that is something that I carry with those decisions when they come to us on council.
Wonderful. Thank you so much for your time. I really appreciate that you've taken this time out of your busy day to be with us.